Your dog looks tired, limping, maybe bruising easily. Blood tests look confusing. But what if the real problem is a tiny tick you never even saw? Today, we're uncovering canine anaplasmosis, a silent tick-borne infection many dogs carry without symptoms until it suddenly turns serious. Before we go further, ask yourself, has your dog been exposed to ticks recently? Is your dog suddenly lethargic or refusing to walk? Any unexplained bruising, nosebleeds, or bleeding gums? Did blood work show low platelets? Does your dog live in or travel to tick-endemic areas? If you answered yes to even one of these, keep watching. What is canine anaplasmosis? Canine anaplasmosis is a tick-borne bacterial disease of dogs caused primarily by two species of Anaplasma. Anaplasma phagocytophilum infects neutrophils, white blood cells, more common in North America, and also infects humans. Anaplasma platus infects platelets, blood clotting cells. Ticks are the vector, especially the black-legged deer tick and brown dog tick. Transmission requires the tick to be attached for many hours. Clinical disease may take 1 to 2 weeks after tick bite to develop. Many dogs may be exposed and develop antibodies without showing illness. A positive blood antibody test doesn't always mean active disease. It may indicate past exposure. Causative agents. What causes canine anaplasmosis? Canine anaplasmosis is caused by bacteria from the genus Anaplasma. Two species are clinically important in dogs. One, Anaplasma phagocytophilum, transmitted by deer ticks, Iodes scapularis and Iodes pacificus, infects neutrophils, white blood cells, causes granulocytic anaplasmosis, often associated with lameness and fever. 2. Anaplasma platus, transmitted by the brown dog tick, Rhipicephalus sanguineus, causes cyclic thrombocytopenia, infects platelets, leads to fluctuating platelet counts and bleeding tendencies. Both organisms primarily target blood cells and are often underdiagnosed. Most dogs infected with anaplasma remain subclinical, meaning they show no obvious illness. But when symptoms do appear, they commonly include fever, lethargy and weakness, enlarged lymph nodes, lymphadenomegaly, enlarged spleen, splenomegaly, lameness or joint pain, especially with aphagocytophilum, bleeding signs such as petechia, ecchymoses, nosebleeds, or gum bleeding. Severe signs often suggest co-infection with other tick-borne diseases like Ehrlichia or Lyme disease. The life cycle of anaplasma involves both ticks and mammals. An infected tick attaches to a dog and feeds for 24 to 48 hours. The bacteria enter the bloodstream via tick saliva. Inside the dog, A. phagocytophilum invades neutrophils. A. platus invades platelets. The bacteria multiply inside structures called morulus. Infected cells rupture, spreading the infection. Another tick feeds on the infected dog and becomes a carrier. Anaplasma is transmitted transstadially, larva to nymph to adult, but not transovarially, meaning mammals are essential reservoirs. Diagnosis and testing. CBC findings. The most common laboratory abnormality is thrombocytopenia, usually appearing 1 to 2 weeks after infection. In A. platus infection, platelet counts rise and fall every 1 to 2 weeks without treatment. Cytology, blood smear. Blood smears may reveal morulas in neutrophils, A. phagocytophilum, morulas in platelets, A. platus. Important, if morulas are seen in neutrophils, Ehrlichia ewingi must also be considered. Serological testing. Point-of-care ELISA tests and IFAs are commonly used, but early infection, the first week, may test negative. Paired titers after 2 to 4 weeks are essential. Antibodies can persist for months. Tests cannot differentiate species. PCR assay, gold standard early.
PCR testing detects Anaplasma DNA within the first week of infection and is the only test that identifies the exact species.
Treatment. Evidence-based. The treatment of choice for both Anaplasma species is doxycycline, 5 milligrams per kilogram PO or IV every 12 hours, or 10 milligrams per kilogram PO or IV once daily. Duration, 28 days. Alternative, minocycline, 5 to 10 milligrams per kilogram PO every 12 hours for 28 days. Clinical improvement is usually seen within 3 to 7 days. Supportive care is rarely required, as most infections are mild. Prevention. Prevention depends on effective tick control. Avoid tall grass and leaf litter. Perform tick checks after walks. Use veterinarian-approved preventatives, isoxaxylines, fipronil, pyrethroids, amitraz. Blood donor dogs should be screened, but early infections may still be missed. Anaplasmosis is often silent, but early diagnosis, proper testing, and timely treatment can make it completely manageable. If your dog has unexplained fever, lameness, or low platelets, don't ignore the possibility of a tick-borne disease. Consult your veterinarian. Prevention is always easier than treatment.